What time should you go to the dentist? Tooth hurt? No.
Don't wait till your tooth hurts to see your dentist. See them regularly. How, you ask? Stay tuned and you'll find out.
Question 1. What does ECC stand for, and what is it?
What does ECC stand for? It stands for Early Childhood Caries. And you can see on here that this is a healthy baby's teeth. This is what it's supposed to look like. And this is moderate decay. This is moderate to severe decay and severe decay. And the ways to prevent this is don't let your child sip constantly on drinks with sugar. That especially includes sippy cups or putting them to bed with drinks. And when your child is crying, make sure you don't dip the pacifier in sugar or honey. This can cause the severe decay that we were talking about earlier.
Question 2. How often should you go to dental appointments?
It depends on individual need, but Denti-Cal can help you determine that.
To qualify for Denti-Cal, you would need to qualify for Medi-Cal, and to do so, you'd be under a certain income level. Or you could also qualify if you're under 21 or pregnant. How to apply for Denti-Cal? That's through the Covered California application, which we will link on the bottom of the video. So with Denti-Cal, you're allotted a certain amount of money for each dental treatment. So you can go up to a certain amount of money, which is $1,800 per person per each calendar year if you're 21 or older, and it's similar if you're younger. So in order to apply for Medi-Cal or Denti-Cal, you could either go online or you could call the phone number, which is 1-877-752-4737. You can also find a local Covered California agent or find a Covered California storefront near you. Now, in order to apply your benefits at the dental office, you would need to find a dentist that accepts Denti-Cal and let them know that that will be covered when you actually go for the appointment, that the Denti-Cal will be covering your treatment. You will need to bring your IC and a photo ID, such as a driver's license or state-issued ID. Also, you may need to pay a co-payment at your appointment, depending on how much of the money you have left for the year. But if you aren't able to pay the co-payment at that time, they can't deny you treatment.
Question 3. When is the first time you should take your child to the dentist?
When their first tooth comes in, or by their first birthday.
Question 4. How often should you brush your teeth and your child's teeth? And how often should you floss?
The most effective way to brush your teeth is the technique called the Bass method. So let me show you how to do that. So you want to focus on about 2 to 3 teeth, brushing back and forth, short and soft brushing method for about 5 to 10 seconds. Then you move on to the next section. Again, 5 to 10 seconds, and make sure you're angling your toothbrush towards the gums, because underneath the gums is where the bacteria likes to hide. So you just go around the mouth again, 5 to 10 seconds on each section. Make sure you get every section. For the bottom teeth on the inside, you may want to angle your toothbrush like so. Also make sure to get the tops of the teeth, the fronts, and the back. Also, you'll want to brush your tongue because bacteria can hide there as well. Now, toothbrushing doesn't get in between the teeth as well, so it's important to supplement your oral health care with another device. Flossing is a common one that most people do at least once a day because it can get in between the teeth better. So what you want to do, you go back and forth to get in between the teeth, and you kind of do a C shape in between the teeth. Make sure you're swiping against the side of the teeth, and now you can't see in this model, but you want to get underneath the gums as well. Make sure you get the sides of both of the teeth that are contacting there. And you just go around the mouth doing that in between each teeth. Also, you want to try and get the back of the last tooth as well. But yes, you want to do that at least once a day to clean out that area because that's where the bacteria likes to hide.
Question 5. When your child starts teething and a brush is too big to fit in their mouth, should you wait until their mouth is big enough for you to start taking care of their teeth?
No, don't wait. Even if your child only has gums, it's important for them to get used to a dental care routine for when they don't have just gums anymore. Hi there. So I hear you're expecting. Do you have any questions for me?
Yes, I want to take care of my teeth and then little Tiffany's teeth.
That's so good. I feel like a lot of people don't realize how important it is to take care of your teeth, especially when you're pregnant, because a lot of the stuff from your body can be transferred to your baby. So you can actually do some preventive measures so you can contribute to better health for your baby. You heard of xylitol gum? Okay, so you know how there's like sugars in your gum, right? So xylitol is actually a non-sugar, but it's almost like a replacement, and it's really good because it actually stimulates like your saliva to lessen the numbers of all the bacteria that causes cavities. And obviously for your kid, you don't want them to have like really rotten teeth and stuff. So that can result if you don't watch like what your baby's eating and everything. But they can have like an even stronger response to the bacteria that causes that if you chew on this gum, because it can actually lower the levels of those bacteria. So xylitol gums, we have supplements here. You can just chew it throughout the day. You can also just get it at the store. Those little icebreaker mints, you know what I'm talking about? Those little like those green ones that you see at the front. Yeah, that also has xylitol. But just to warn you, one of the fun side effects of it is you can get a lot of gas. So just be aware of that, but in the long run, it's really good for you because then you won't get as much cavities, you'll be at lower risk, and then that's going to be passed down as well to little Tiffany. You might also want to be aware of these things called pyogenic granulomas. It's a really fancy, scary word for pregnancy gingivitis. It's basically these benign growths, just comes from when your gums are overreacting to the plaque in your mouth. So again, this is why you have to take care of your teeth every day, because you're always going to have bacteria, and you want to lessen the amounts of bacteria that are in your mouth. So to get rid of these little growths, which tend to occur like in the front of your teeth, you just want to get into a routine of brushing your teeth very well. So that means that because it starts from the gum, you want to kind of get your toothbrush, angle it a little in there, and actually get in the routine of cleaning in between your teeth as well. Do you like to floss? It's okay. There are other options that you can actually find at the drugstore, like brushes that you can put in between your teeth. They're just really high-risk spots for getting plaque, and if you let that plaque rest there, it can actually cause your gums to overreact, and then that's what causes those like nasty little growths. If it's really bothering you, we can actually get rid of it for you, but you'd have to come during your second trimester for that. Just be aware that it can come back. But usually those growths go away after your pregnancy. So totally normal stuff. That's just something to be aware of. And do you know how many times you're supposed to brush your teeth every day?
3 times?
It's actually recommended to do just 2 times a day, just morning and night, and take care of, just in between those teeth. So you don't like to floss, but you might want to consider doing like those little brushes you find at the supermarket. Just go in between and get the plaque off of there.
Toothpicks?
That is definitely an option. We have so many options for how you can clean in between your teeth, but really the main thing is you just want to clean in between there and not neglect that.
What about little Tiffany?
Oh yes, okay, so fun fact, it is actually important to take care of little Tiffany's mouth even before she has teeth. Even though, your baby has like just the gums and stuff, really important to just get into that routine of using, you've heard of gauze before, right? It's just like the little cotton,
Is
like
that the
squares.
thing for wounds?
Yeah, you could even just use like a napkin or something.
Okay.
Like it's really good for just rubbing along like the gums of your baby's mouth, really getting rid of that bacteria, because it's everywhere. Bacteria is everywhere, but you can lower those levels by just getting into routine. Usually maybe around like bath time for Tiffany. That'll get her used to a dental healthcare routine. So when she has her first tooth, definitely come in and see us. You can actually start using a toothbrush at that time. Just make sure it's an age-appropriate one. Like those kids' toothbrushes like Orajel, Oral-B, really great because they got those nice soft bristles, really gentle. You'll want to put like a little smear of kids' toothpaste. A smear, okay, not like a whole pea. And that's because, kids' toothpaste tend to have fluoride. You've heard of fluoride, right?
Yeah.
Yeah, fluoride helps them with not developing the cavities. You want a smear because if you put too much, they can actually develop this thing called fluorosis. Have you heard of?
Really?
Yeah, have you heard of fluorosis? Like those little white specks. So definitely just put a little smear. Put it all over the teeth, and then just careful. Those gums are just really sensitive, obviously, because with first, erupting teeth. Make sure to really lift the lip because that's hiding a lot of that tooth structure. So just go ahead and make sure you get those surfaces because that's where they can get a lot of cavities.
I've heard that when babies are teething that they get a little cranky and upset. Like, do I still take care of it when the teeth are coming in, or?
So what you can do is you can actually just get a nice cold soft towel and you can just put it in between your baby's teeth. You might have seen those little teething rings.
Okay.
Those are available at Target, CVS, Rite Aid, you name it. It's just they gotta get through it. It's a fun time of having your kid.
I've heard that some people put like numbing stuff.
Ooh, the danger with that is your baby doesn't have like a really good swallowing reflex yet. So what that means is they can actually swallow the numbing solution and then they can't, tell whether they should gag or not, like say they're feeding, right? And then they might actually choke. So not a good idea.
Okay.
Every dental professional has a different opinion. I would say just stick to those teething rings and stick to the cold towel. Any other questions?
I think that answered most of my questions.
That's great. And then do you know how often you need to replace your toothbrush? So 2 to 3 months is a really good way to go. Just good rule of thumb, whenever you replace your toothbrush, replace your baby's toothbrush and you should be good to go.
Okay.
When I'm feeling lonely, sad as I can be, all by myself in uncharted island in an